Good afternoon, everyone, and thank you for joining me today for another Leadership Dialogue session. I'm Wright Lassiter, President and CEO of Henry Ford Health and Board Chair for the American Hospital Association. I can't tell you how much I'm looking forward to today's conversation as we talk about the role of hospitals and health systems can serve in partnerships to improve health and well-being of the individuals and the communities we serve, while maintaining our shared industry goal of advancing health equity. If COVID-19 has taught us anything, it's that we are all connected, and the health and well-being of our neighbors has a direct impact on the health and well-being broadly, whether that neighbor is across the street or on the other side of the world. Engaging in work to improve the health of communities we serve and addressing social determinants of health has become an integral component for many hospitals and health systems across the United States as they look to meet their mission of advancing health. I'm pleased to introduce today and to spend some time with a community health expert, amongst many things, Mikelle Moore. Mikelle has been a part of the Intermountain Healthcare's leadership team for more than 20 years. Joining the executive leadership team and serving as the organization's chief community health officer in 2017. Intermountain Healthcare is a team of more than 40,000 caregivers who serve the healthcare needs of people across the Intermountain West, principally in the states of Utah, Idaho, and Nevada. Intermountain is an integrated not-for-profit healthcare system that's based in Salt Lake City, Utah, with clinics, medical group, affiliate networks, hospitals, home care, telehealth, health insurance plans, and many other services. So as you can see, when we say integrated, we really mean fully integrated with all the components that a health system could need to advance health in its community. Throughout Mikelle's career, she has been a pioneer, leading healthcare's pivot towards addressing social determinants of health, preventing avoidable disease and injury, and improving mental health well-being. Her work supports Intermountain's mission of helping people live the healthiest life possible. Mikelle also serves as president of Intermountain's Community Care Foundation. And if we have a little bit of time near the end of our session, we may talk a little bit about that foundation as well. Thank you for joining me, Mikelle, and please join me in welcoming Mikelle to our session today. And let's sort of dive right into our conversation. How are you today?
Right. Thank you so much for having me. I'm doing well and have been really looking forward to this conversation. So thank you.
Well, it's my pleasure and can't wait to spend some time with you. So let's talk a bit about maybe our first point of conversation. You know, I think we both know, and many of our viewers today will know, that hospitals and health systems are moving aggressively forward in our actions and our activities to support the communities that they serve. Would you mind just sharing your thoughts about the role that hospitals and health systems should play? Should they be leaders? Should they be conveners? Should they be community partners, or all the above? So maybe we should start there, and then we can talk subsequently about examples from Intermountain.
You know, I think whenever there's an all or above option on a multiple choice, you have to carefully consider it. And right, I think that in this question, it's clearly all of the above, but not in every situation. We have to really be in tune and listening and asking our communities, what role do they need us to play? And whenever possible, we follow that community lead. And what I mean by that is when there are existing community coalitions to address an issue or to engage a specific community or neighborhood, we really need to be members and participants to build that trust and relationship with community partners. And other times, we need to be leaders on issues. We need to serve as an example, take some risks ourselves in the community to demonstrate the importance of an issue. And then other times, there is a need for convening. There's lots of different or disparate interests even in a community, and a hospital or a health system has a unique opportunity to set a table in a thoughtful way with the right people in different positions of power around that table to create the opportunity for conversation and problem solving. So I think it's really important that health systems be comfortable with all of those roles and listen very carefully to what a community needs in order to get where it wants to be.
Great. Well, I appreciate that answer. Would you mind maybe sharing a couple examples from Intermountain about how Intermountain is potentially served in any one or more of those roles in the community that would help give our viewers and listeners a bit of a little more granularity and some of the amazing things that Intermountain's doing?
Well, thank you. You're kind. And we're learning so much from what you and other members of the American Hospital Association are doing as well. At Intermountain, we've taken different roles depending on the situation. When the opioid epidemic was first really becoming something that we squarely wanted to address, we heard from our community that that healthcare needed to step squarely into a leadership role in this issue because we were at the cornerstone of contributing to the problem. And in order to move upstream on that issue, healthcare needed to lead, convene, be bold. And so we took a very bold leadership role and convening role, as well as funding some of the solutions and other mechanisms, but changing the way we delivered care. When we looked at what is the role of a health system or our health system in addressing the social determinants of health in our communities, we knew we were not the organization that could address the social determinants of health in communities. So we actually first asked and listened and went into communities and conducted some actually in-depth interviews with people who were most at risk for having high social needs conflict with their medical conditions. And in that situation, we identified different roles for Intermountain in different communities. In one community in Ogden, there was a very strong coalition that we were invited to join and just participate in coordinating and responding to social needs of that community. In St. George, a more rural, newer community with a more conservative population, they were saying, we really need someone to organize us, to convene us. We have a lot of interested parties, whether in the justice system, school system, mental health system, and we really need someone to set the table for us. Can you convene that coalition? And so I think providing those types of unique opportunities or seeing those opportunities is really important. One that the last example I'll share is, as we've gotten really introspective of our role as an anchor institution, and I know Henry Ford Health System is a member of the Healthcare Anchor Network, we have learned that there's a lot of public assets owned by school districts, counties, cities, particularly in this part of the West, where ownership of land has been a conservatory approach to protecting the future of our public. And utilizing those assets for public good is something that can greatly contribute to the health and well-being of our communities. And so Intermountain, hearing this from some of our community leaders, helped commission some research to understand the public assets in our community. And that is now paving the way for some leadership around how do we want to develop our public assets. And Intermountain is speaking to the social determinants of health, but joining with some other community partners in ways that contribute to our thinking as a community.
So I really appreciate you illuminating some of the approaches that Intermountain's taking. You talked about a number of things that we could sort of double click on. You talked about the role of role of health systems as anchor institutions and what that means. As you described the various roles that a system could play, whether it's convener, whether it's leader, whether it's partner, et cetera. I think it really highlights the next topic that I'd like to spend a little bit of time on. And that is, as you think about employee health, community health, issues of trust and power come into play oftentimes. And maybe historically, hospitals and health systems maybe have struggled with this issue around building and creating sense of trust and ensuring that the power that we have is used in the most constructive way to sort of drive community health initiatives. So maybe you could talk a little bit about how might we tackle this issue of trust and power, and what has Intermountain done as you think about advancing community health from the perspective of creating trust and utilizing its power in a way that's constructive and not seen as potentially a barrier to community health advancement.
We can only improve health at the pace that we build trust, I believe, and the disparities that we see across the United States are embedded in every aspect of the way that we interface as a health system with the community. And so I think it's imperative that we're thinking about our role as a health system in multiple dimensions. And in fact, the way we've organized equity work at Intermountain is thinking about it through the lens of our caregivers, which is what we call our employees, our community, our patients, and our members. And we're really intentional about thinking about how do we build trust in every one of those ways we might interface with our community. And I'll share a couple of examples. So here in Utah, we have a large and growing Pacific Islander community. And that community experiences extreme disparities, whether it's with maternal health outcomes, diabetes, or COVID. And we've worked for years to try to address that relationship through community coalitions, grant making, lots of what I would call maybe transactional relationships with the attempt to build an ongoing relationship. And we haven't gotten very far. The moments where we've had real breakthrough is when we've had a nurse practitioner from the Pacific Islander community serving in a clinic in a geographic area where there's a large population, or even when it's not in that geographic population, this community will travel to see someone that looks like them, connects with their culture, et cetera. And about a year ago, we made the very astute decision to hire Jake Futissimanu, who is the leader of the Pacific Islander Coalition, to become a member of the community health team. We are now hearing ideas from them for the first time about what will help address needs for reducing diabetes disparities, addressing maternal health outcomes, just having dialogues about how to create a better hiring pipeline into that community, or a business pipeline for working with businesses owned and operated by the community as vendors or suppliers to Intermountain. So I think we really have to think about how are we inviting people to the table, and not just a coalition table, but a table of influence and decision-making, regardless of the topic, and I really think it's important, right, that we're thinking about who's at the table in our workforce at all levels of leadership, whom is influencing our purchasing decisions, our governance, our investment decisions, as well as then designing care. And, when we get to the issues of care design, we really have to sit with people and understand what's contributing to health disparities, because we're finding we get it wrong. We look at the data, and the data tell us one level of the story, and we're using an approach we're calling equity triads for really understanding the root issues associated with health disparities as a way to unpack and look at solutions based in community.
Yeah. So let me just say, I certainly applaud the tactics and the actions that you just described, and you didn't use these words specifically, but what I think you're sharing with our listeners and our viewers are two characteristics that I would call out. One is this notion of giving communities voice,
yes,
and two, humility, the notion that that while the hospital and health system may be the quote unquote largest player sitting at a table, that doesn't mean we have all the answers. And so this notion of displaying humility to suggest to the community you're trying to impact that you help us, you tell us what would work, as opposed to we sit down and tell you what we're going to do. So I appreciate both the notion of giving voice to the community to advance the needs of health and health equity and wellness, as well as the notion of humility. So thank you for that. As we think about, there are probably a lot of or some listeners who may struggle with this next topic, and that is the notion of how do you measure success? Often every hospital and every healthcare system has its own set of key performance indicators, dashboards, scorecards, whatever term you want to use that might define how they measure success. And oftentimes the historic measures of success, typical patient and system outcome metrics that we have used historically to say we are or are not doing a good job, may or may not be the best way to measure what you're talking about as it relates to community health and well-being and health equity issues. So maybe talk a little bit about how you all at Intermountain measure success and the kind of metrics and dashboards that you all are looking at that helps tell you that you're on the right track to supporting your community's health and well-being.
Well, first, Wright, I'll say that this is a journey and we're not where we want to be yet. Intermountain uses an operating model to manage our performance, and we use it at all levels of the organization. So we're accountable to our board for a set of key performance indicators, and we translate wherever possible those same key performance indicators down to the individual unit level, so that there's a continuity for every caregiver to understand how they're contributing to the success of the organization. And it's really hard to do that and tie to the indicators that are the true measure of success. And so we also have watch metrics that we use as an organization. And so ultimately, what we care about is that the communities served by Intermountain Healthcare are healthier as a result of Intermountain's presence and engagement with those communities. And that we're measuring that using America's Health Rankings, looking at how our score, which is used to comprise the rank in the communities that we serve, changes over time. But our involvement or market presence in each community is really different, and our opportunity to influence that is different. And so we've been really looking for what is a metric that will create a closer tie, if you will, between those broad population level outcomes and the performance indicators of the health system. And so we're working on a value scorecard. So what will drive greater affordability, greater equity, and higher outcomes in the health system, as well as an equity index to really understand, are we becoming a more equitable organization, and are the communities we're serving becoming more equitable because of our work? And I'm really excited to have these capabilities to measure our performance as a system. And we ultimately think these metrics are going to be more important in the long run than the KPIs we're measuring today. But we have KPIs in access, quality, stewardship, patient experience, growth, equity, and we're measuring equity as an example in a way that we're reporting to the board all the way down to every business unit in terms of how they're achieving one aspect of equity today. I hope that becomes a broader metric as we work to really understand how we can contribute to those population level outcomes.
Great. Thank you for sharing. Both Henry Ford Health and Intermountain have been on this journey around impacting their community's health for a long time. As you said on several occasions, it's a journey. And so we don't have everything, we don't have every answer, we don't get everything right, but we're on a journey to getting better. But we have to acknowledge that not every hospital and health system have been on the journey to advance community health and well-being probably as long as we have. And so there may be listeners to this podcast that are asking some fundamental questions like, how do I prove the business case to my organization that advancing community health is in our interests, that maybe we don't own a health plan like Henry Ford or Intermountain, and so we don't have the ability to, have the premium dollar to help quote unquote fund investments, or we don't have the integrated model that you all may have. And so what advice would you give to those leaders who have the same desire both in their heart and in their brain that we have with our organizations, but have an organization that's less mature and hasn't sort of developed the wherewithal as a strategic imperative? What might you suggest to them as the business case? How have you made that case in Intermountain during the last 5+ years that you've been the chief community health officer? Just give our listeners some insights on how they can climb the mountain, so to speak, and help advance this as a strategic issue for their organization.
Well, I think there's two components to this. I think one, it's really listening to what are the community's priorities for where the health system should be impacting the community's health, because where there's interest in community, there's resources, there's a willingness to engage and be involved. And often there's an ability to match up other grant funding resources, philanthropic resources, or in today's day, ARPA funds that flowed through to states, counties, and cities as a way to blend funding and impact. The other component is really listening inside of your organization for where there's an alignment of operational priorities or organizational priorities that fits with those community needs. And I'll give you a couple of examples. I do think that making grants in the community and, just giving of our traditional community benefit requires that an organization is financially sound or has an endowment mechanism to do that. And given the pressures facing healthcare today, I recognize that could be one of the greatest challenges we face in the next 5 years. However, we all have a staffing challenge right now. Everywhere I go in the country, I'm hearing about the difficulty we're facing hiring and retaining a workforce. And and then also, when you listen to our communities and what they need, there's a lot of disparity in the earning potential of minority communities or LGBTQ plus communities or English language learning communities or differently abled communities. There's a different earning potential in those populations than there is in majority or white or able populations, et cetera. So one of the win-wins that we are really going big on right now is thinking about those hiring pipelines that we can foster in communities that address the equity issues, but also create a really valuable resource for Intermountain and reduce the cost of hiring, the cost of retention or cost of turnover, and create a return on investment that might not be very traditional from a community health perspective, but it absolutely changes the trajectory of health potential for the communities that we serve.
Great. I appreciate that. The only thing I would add to that very well thought out response is to say to folks who are early in their journey, don't take this like world peace or world hunger. Do not try to take off, the whole notion of how do you eat an elephant one bite at a time. So when you start this effort, don't presume that you have to solve every problem tomorrow because it will be overwhelming. And then that can create, back to the point of all the pressures that our field is facing. You can oftentimes get folks who just get overwhelmed by the enormity of the challenge. And if you break that into smaller components and show progress, that's one way to sort of take on this challenge. So really appreciate it.
Right, I couldn't agree more. And I think it's so important to, we use this concept of triad all the time, a really excited, willing community partner and a really excited, willing internal organizational operational partner, and do one thing together. Because where there's will and interest, you get so far. Whatever your idea is great, but if you don't have someone willing to champion it with you, it doesn't go very far easily.
Well, we get, I unfortunately get to this conundrum every time I have one of these dialogues, and that is I have 2 or 3 or 4 more questions I want to ask, but we start getting near the end of time. And so let me just end with one question, to be respectful of our audiences and their time. Before we went on the air, we talked a little bit about Intermountain's Community Care Foundation and the approach that you all have taken, and that many organizations attempt to take to try to help fund some of the investments that you want to make. Maybe just share a little bit about what that is and how that mechanism enables the success of Intermountain, and maybe how others could emulate that. Maybe not at the same scale as Intermountain, but the best way to start every journey is to take a step, and not presume you have to get to the finish line, with the first step. So talk a little bit about the Intermountain Community Care Foundation, and we'll probably end on that note for our listeners today.
Okay, thanks, Wright. So Intermountain recognizes that the opportunities to improve health in our communities are not episodic. We can't just invest once a year or when we have a strong financial performance, that there are some issues that take decades to solve. And therefore, we've had the wonderful foresight and wisdom of our Board of Trustees to establish the Intermountain Community Care Foundation, where in times of strong financial performance that exceeds plan, or when we sell an asset, a land asset, and want to really demonstrate to the community that the proceeds of that will benefit the community for the long run, we're able to place those funds in the Intermountain Community Care Foundation. The earnings on which then are used to fund or catalyze community health improvement in a way that allows us to be really strategic over time. We place those funds right alongside our grants that come from operations, or our impact investment dollars, where we're making investments using our balance sheet or our portfolio, and try to create a combination of solutions to address the problem. And we've chosen, there are funds specifically in the foundation to address the social determinants of health, mental health and well-being, and access to primary care, because those are issues that we've committed to solving across our communities over the long term.
Great. Well, again, we could go on for another hour or so easily on this topic, but we do need to be mindful of our listeners and the schedules that they are balancing. So, Mikelle, let me just first and foremost say thank you for the work you do on behalf of Intermountain and in supporting and serving the communities that your organization serves. Secondly, thanks for joining me today. This has been a great conversation, and advancing the health of the communities we serve is a passion of mine. And so this was a great treat to look forward to spending a little bit of time with you. And I would just say that as our field continues to advance our efforts towards advancing community health wellness, reducing disparities, improving health equity, obviously we'll continue to look to you and your colleagues at Intermountain for lessons that can be pearls of wisdom for the rest of us. And so until next time, thanks for joining us for our Leadership Dialogue. It's been my absolute pleasure to have our guest today, and we look forward to seeing you for our next dialogue. Thanks for joining. Have a good day.